Okay, so America is wound up tight over protein. Got to eat protein. We need protein. More protein is better. This is America. I'm getting some darn protein. So on my mailing list, people are back and forth, you know, I found some great protein. Where did you score your protein, man? I got a hit of 38 grams of protein the other day. Ooh, wow, where'd you get it? I got a protein shooter at GNC. It's orange. So people are tense about protein. Okay, so I want to do a little experiment here. Each of you have talked to at least 10 of my other patients, right? Okay, how many of my patients, of all of you that you've talked to, how many of my patients have had low protein problems when you talk to them?
0.
Okay, so that's like 10 people times 10, like 100 people maybe. Nobody has low protein. Now, there are a few people who get low protein. It can happen. Most of you are going to be fine, so don't worry about protein. Is a little extra protein supplement good, like the whey protein? Yes, but don't worry about it. In general, do you have to eat your protein first when you sit down to eat a meal? No. Do you have to worry about protein? No. Should you eat a little bit of extra protein as a supplement once a day? Yeah. I could care less how much. If you're measuring how much, you need to get a hobby. You need something else to do.
Online, they're like 60 to 80 for a woman.
I know, and I don't agree with that. You don't hear me saying 60 to 80 grams of protein because I don't tell my patients how much protein. I say relax, eat a regular healthy diet, and don't worry about the protein. I believe, in fact, that very high doses of protein increase your chance of kidney stones. And I can tell you, you do not want to have a kidney stone. I have had a kidney stone. You do not want a kidney stone. High protein diets increase the risk of kidney stones. Don't do it. Just hold off for a second because we're going to finish up our patients from last week. That's okay. How are you?
I'm doing pretty good.
Good.
I had a little experience this morning of getting up and going, oh no.
And so you've lost 13 pounds. See, that's too much water, and that's why you're a bit dehydrated. Yeah. So you want to think about the drinking, thinking about the soups, thinking about just even tear open an emergency pack of salt from McDonald's.
I thought I was doing all that, but apparently it's not enough.
That's exactly right. Almost everybody who calls me and they say I'm dehydrated, we say take more salt, and they say, you blockhead, I'm taking salt. I go, in the nicest possible way, it's not enough. And you don't understand, I'm taking this. I said, but
yeah.
I went through that, and I emailed Dr. Rutledge because I couldn't get out of bed. I couldn't lift my legs.